placement of the spinal cord injury and the severity of the injury to a specific region determines one's ability to control their limbs below that area. Spinal cord injuries can either be referred to as complete or incomplete injuries. Complete means that all sensory and motor function below the spinal cord injury is lost. Incomplete means that one may have sensory or motor function below the injured area. Paralysis from a spinal cord injury can be referred to as either paraplegia or quadriplegia. Paraplegia is paralysis that only affects all or part of the trunk, legs, and pelvic organs, while quadriplegia affects the arms, hands, trunk, legs, and pelvic organs. Medical concerns and symptoms include loss or lack of movement in limbs, altered sensation to touch and temperature changes, loss of bowel and or bladder control, muscle and joint spasms, loss or changes in sexual function, pain or stinging in nerves around the spinal cord injury, and respiratory issues such as difficulty breathing or coughing. All of these symptoms may vary depending on which area of the spinal cord the injury occurred.
In terms of inclusion, there are many ways we can include people with spinal injuries in everyday activities that vary depending on the activity. A good way to start would be to see what the person is interested in and go from there. Because movement is limited, they may require assistance in the sport. Sports such as badminton would require the racket to be strapped on and the use of a larger birdie to give them a larger target. You may also make the court shorter to adjust for different strength levels. Other sports may also require the use of different equipment and adjustments to make the sport more accessible for all. One example of someone who is quadriplegic is Nicholas Pieter Dupré. He is a South African athlete in paratriathlon. He was the first person with quadriplegia to ever finish an Ironman triathlon in the year 2014. He started competing at the Berlin Marathon in 2008 and was a 7-time winner since the year 2012. In international events, he competed at the 2012 Summer Paralympics in the 100-meter event and won medals at the UCI Paracycling World Championships from 2014 to 2018. He crushed the boundaries for what is possible and continues to lead the way in paratriathlon. Next, we have a short documentary about Nicholas with a link at the end if you want to learn more.
There's no line defining before and after my accident. In my mind, it's just one continuous path. I was running before my accident, and I'm still running. Maybe just in a slightly different way. Number of days in ICU, 42. Number of days on a ventilator, 32. Fastest time for getting dressed is 2 minutes 41. Fastest time to get in the car is 1 minute and 18 seconds. Number of international marathons, I've won 3. My time for the full Ironman, 13 hours and 24 minutes. It's now been 10 years and 6 months since I became C6 quadriplegic. C6 quadriplegic means that you're completely paralyzed from your nipples down. You only have limited arm function. I don't have any triceps, I don't have any finger or hand movement. I only have wrist extension, biceps and shoulders. I'm the first quad in the world to do Ironman. For Ironman triathlon, I have to make the able-bodied cut-off times. You have to almost train like an able-bodied pro Ironman athlete would train. So I spend about 40 hours on training per week. I always have numbers when I train in my head. People think I've got an obsession with numbers. I time silly things like getting dressed, 2 minutes and 41 seconds, how long it takes me to get in and out of the bath. I've gone under 5 minutes from getting in the bath and then out again. Time myself getting out of the car and up the lift to my work office. I'm actually an actuarial analyst. I work with numbers on a daily basis. It's like I'm a double agent leading a double life, doing numbers by day at work But doing numbers when I'm doing sport, doing numbers when I'm just getting dressed, it hasn't even sunk in that I actually managed to do that Ironman. It's 3.8 kilometers swimming in the sea, followed by 180 kilometers on the bike, which I cycle on the hand cycle. And then it's a full marathon running, which is 42.2 kilometers, and I do that in the racing chair. Despite being the first squad in the world to finish Ironman, I would still say something that ranks even higher than that is becoming completely independent. I'm one of the fortunate few that has the sports structure and financial means to be able to carry on and live a full life and a quality life. There's been a lot of research in spinal cord injuries and finding a cure for it. The big reason that I would like to see a cure is not for myself. It's actually for the other guys out there. I see how they struggle with depression for years. Some never get over the fact that they're in a wheelchair. It saddens me to see those guys, and I hope that I'm an inspiration for them. In the end, if there's a cure for spinal cord injuries, that will just fix everything. A lot of people think there must be days where it just gets too much or it just gets too hard. The moment my mind just wants to think things are too much, I just realize what impact I make on a daily basis. One man can make a difference. I often get told, that I got a second chance at life. I disagree with that. In some cases, I actually feel like I was born to be a quad. The day my accident happened, there was no mistake. I made certain choices on that day that got me at the exact time and place for that car to hit me and me breaking my neck. I don't look back because it is what it is. And I'm hoping the way I'm living my life now as a quadriplegic is an inspiration to all out there. For me, this is not the end and neither is it the beginning. I'm still following the same path.
Now let's look at short-term memory loss caused by brain injury. Sometimes when a hit to the head is severe enough or happens more than once, a traumatic brain injury, or TBI, occurs. This affects brain function, and several symptoms of TBI are shown here. Physical, behavioral, and cognitive changes can occur. In this case, the student suffers from short-term memory loss. TBI affects short-term memory more so than long-term memory. Short-term memory is all the information we gather in the present and is stored in the prefrontal cortex. The temporal lobe contributes to the processing of new material in short-term memory. In this case, a brain injury can cause the process of memory formation to fall short somewhere along the way. Someone with short-term memory loss is often forgetful of many different things, such as when appointments are, whether or not they've taken prescribed medication, why they came into a room, or new names of people they meet. Safety considerations and medical concerns are not as significant for this cognitive disability in the classroom setting. However, teachers and peers should be aware that the student may be forgetful of instructions, safety precautions, and movement mechanics when learning new skills.
Many external memory aids can be used to great success, such as smartphones, date books, notebooks, wall charts, pages with sticky notes, photos, and albums. Often the most success can be seen and made by people who are positive and determined leaders. Some useful information for coaches and student leaders is to repeat and emphasize important information. Other students can also be recruited as memory guides. Verbal reminders can be effective as short-term adjustments. Many examples of professional athletes can be found. One specific example is of Andre Waters. Waters was regarded as one of the league's hardest-hitting defensive backs during his career with the Philadelphia Eagles. Unfortunately, he committed suicide in 2006 at the age of 44. An autopsy showed that his brain tissue was similar to the brain tissue of an 85-year-old Alzheimer's patient. Dr. Bennett Omalu told the New York Times that if Walters had lived another 10 to 15 years, unfortunately he would have been fully incapacitated.
Alright, so our athlete has Stargardt disease, also known as macular degeneration. This is a genetic eye disorder that causes progressive vision loss, and it affects the macula, which is the area of the retina that is responsible for sharp central vision. The macula is responsible for detecting light, sending signals to the brain, and later interpreting that light into an image. This disease can be diagnosed and inherited as young as 12 years old. It inhibits an individual from visualizing and seeing what is happening around them, which can also alter the way that they perceive things. And currently, there is no treatment or cure available for this disease. However, it can be managed by using special glasses that protect against UVA, UVB, and blue light. There is also a dependency on the vestibular system, which is also located in the ear and is responsible for providing your brain with information about motion, head position, and spatial orientation. It also helps with motor functions that allow us to keep our balance, stabilize our head and body during movement, and maintain posture. Because your vision is limited, we need a way to maintain balance, and our vestibular system actually does a good job of doing so.
Some safety considerations for those with Stargardt disease is to wear special glasses or sunglasses, and also to avoid bright lights and direct sunlight to preserve the vision available. You are likely to have more progressive vision loss if you have Stargardt disease. It also interferes with night vision and color vision. You start to develop the symptoms before the age of 20. Those who have Stargardt disease say that it seems like it's blind spots in a visual field. You're also increased to the risk of injuries and delayed reaction or response time because your vision is limited.
Some notes that we would like to provide to the leaders are, it's really essential to provide someone with Stargardt disease some vision neutral equipment and ensure that the environment isn't too bright. So you can provide them sunglasses or maybe be mindful of how much light is actually in the environment. So rather than practicing outside where there's bright sunlight, you might want to take this into a gymnasium and dim the lights so it's not too harsh on their eyes. In order to guide the athletes better, provide them with verbal cues that also give them a sense of direction so that they know which way to move and what to look for. Because vision is limited, there is a heavy reliance on the auditory system, so that athletes must know how to move or execute each movement during performance. You can also provide them with any equipment that makes noise so that the sounds and the direction of whatever is moving is a lot more audible.
We have found 2 athletes who suffer with Stargardt disease, but also are Paralympians. The first Paralympian we found is Jason Smith from Ireland. He was diagnosed with Stargardt disease at the early age of 8 years old. He has a world record for winning double gold at the 2010 Paralympics. Elizabeth Clegg is known as one of the fastest women on earth. She also suffers from Stargardt disease and uses a guide dog to get around. She won a silver medal at the 2012 London Paralympics. She describes her Stargardt disease, quote unquote, looking at a pixelated computer screen or a scrunched up firework. Previously, Elizabeth was able to run in the T12 category, which is for the less severe vision loss. Because of her eyesight that has gotten much worse, in order to compete, she must wear a blindfold to allow an equal playing field.